Massachusetts General Hospital Orthopedic Surgery provides expert treatment for knee arthritis, including simple and complex joint replacements. The program's joint replacement surgeons have more than 160 years of combined surgical experience and perform over 1,000 knee replacement surgeries each year. At Mass General, patients have access to the latest approaches for knee replacement, including a variety of minimally invasive techniques and new materials. At Mass General, knee replacement surgery has a high success rate. 99% of first-time knee replacements are successful, with only 1% of patients requiring revision surgery within 1 year of their initial operation. 94% of patients recover without any need for readmission to the hospital within 90 days of surgery. Patients undergoing knee replacement surgery at Mass General have a smooth recovery, and nearly half go home the same day or the day after surgery. Mass General surgeons track patients' recovery and rehabilitation from knee replacement surgery to ensure the best possible outcome. Prior to surgery, patients are asked to self-report knee pain and function symptoms on a scale of 0 to 100, with 0 representing extreme knee problems and 100 representing no knee problems. Patients are surveyed again after surgery to measure improvement. Patients experience improved knee pain and function after undergoing knee replacement surgery at Mass General. On average, patients report a 10-point improvement 3 months after surgery and a 15-point improvement 12 months after surgery. Visit massgeneral.org/compass and click the links below knee to learn more.